We are here at the said address in Lubbock, Texas, on a Southwest tour of Texas and Oklahoma that we've been on for a little more than a week now. There's 25 cities nationwide where we are trying to bring to the attention of the public about the perils of Obamacare. And as a practicing physician and a state representative from Oklahoma, I authored the legislation to give our citizens a choice, and we hope that Texans and other states, right now there's 38 other states that are proposing an opt-out resolution or bills to make it law to opt out of Obamacare. The details of Obamacare are very sketchy, but what we do know about this is that the law itself will be very similar to the rationing that we've seen in European and Canadian style systems of socialized medicine. Those are taken out of the actual law itself. We will see an unelected health commissioner or a czar that will be choosing benefits. There'll be continued and more increase in illegal aliens that will get free health care, which will put undue stress on the system. The federal government will have access to your bank accounts with electronic transfers, and we predict in 3 years under Obamacare that all private health care plans will basically go out of business. Already we've seen two major players just in the last 2 to 3 weeks, Humana and Principal, that have greatly reduced or quit the health care insurance business. All employers must enroll their employees in the government plan. All doctors will be made government employees. Anybody that has a chronic illness, such as cancer patients or renal failure patients, heart patients, will go to the end of the line, will be rationed as they are in Canada and in the European style. As I mentioned earlier, the Canadian Prime Minister came to the United States for his heart surgery as they could not provide that in his own country of Canada. No new private hospitals. They've all been basically canceled. 60 so far, just because of Obamacare, will not be able to build any new private hospitals or physician-owned. And then there are advanced directives for death squads, or whatever you want to call it, life and death situation. I should further clarify that. There'll be 150 new agencies under Obamacare, and in comparison to that, FDR only created 40 new agencies, and that took him 14 years. Obamacare is not a smoking gun, it's a loaded gun. It's going to take away freedoms from Americans. It's going to basically take away the individual liberties that we've shared with the freedom of choice. As I mentioned earlier, people will lose the choice of their family doctor they'll be assigned. There's a three-approach plan of Obamacare to be able to, we call it the triple R, reject it, resist it, and repeal it. In the state of Oklahoma, we offered legislation, as 38 other states have, to opt out of Obamacare by choice. Doesn't mean they will get rid of Obamacare. They will basically have a choice to keep our citizens from being fined or subject to higher taxes or even prison sentences. And as a result, we see other states now following suit, and it's my understanding Texas has legislation pending in their next legislative session very similar. The second part would be filing a lawsuit, which we are in Oklahoma, and 42 other states are doing that on the constitutionality of Obamacare. And then the third thing would be able to repeal it at the federal level. And many congressmen and senators are working on that. Our own U.S. Senator from Oklahoma, who's also a physician, Dr. Tom Coburn, is proposing the repeal of Obamacare. The costs are prohibitive. It will not lower the uninsured at all. It'll basically, we'll have the same uninsured. It will basically go through the roof with the costs. Medicare will be taken out initially $500 billion, and over the next 20 years, Medicare will lose $3.7 trillion in the funding. The elderly are targets. We feel like that the law unjustly targets other individuals that necessarily would be uninsured or uninsurable. The uninsured won't change. The uninsurable maybe will change, but unfortunately, even the President of the United States hasn't even read his own law, and many congressmen and I have read the law, and these are the details that we see. The powers expansion of the federal government is numerous with 150 new agencies. The 2,500 page bill has been compressed into 905 pages, and it's so small you have to have a magnifying glass to read it. Purposely, we feel like that they don't want us to read that. There'll be 16,000 new IRS agents to make sure that employers and employees comply with the law. The doctor-patient relationship be gone. We feel like it's a grab on socialized medicine never seen before on these shores of our republic. Karl Marx put it very well. He said in 1850 that you can have an old social order in the new social order by using medical control of medical health care. Vladimir Lenin, the father of Soviet communism in 1917, has said you cannot completely control a society until you grab the apex of the triangle, which is health care. Cannot completely socialize that society. At the base of the triangle, you can socialize agriculture, industry, education, commerce, but once you grab health care, you completely lock up and socialize that society. We've seen as recently as 1966 where the Communist Party of the USA has said that they want to have socialized medicine and take away the opportunities for the private sector of health care. One thing in the law that we feel like is not even related to health care, among other things, is that the federal government now will be able to come into your homes and take surveys on what you're doing. If you're homeschooling, they will take a survey and tell you what to do as parents to take away your rights as parents on how you want to educate your children. Numerous agencies that we see as strictly a control mechanism under the health care law, and even communist dictators such as Fidel Castro congratulated the president on delivering this new health care package. Other members of the administration that will be administering under the Obamacare law are people that, like Anita Dunn is the Director of Communications of the White House, and she said that she thought that communist dictator Mao Zedong was a great philosopher and should be emanated. The new Director of Administrator of Centers for Medicare and Medicaid, Dr. Donald Berwick, he wants rationing similar to European socialized medicine as well as Canadian socialized medicine. And John Holdren is the new science czar, states that he wants the United States to lose its sovereignty under a new planetary regime. These people are all quoted in print as well as on video, and we also have found many others, but in closing, the person that really concerns me is the President himself when he didn't read the bill and pushed it through by only 5 votes in Congress. So that's my introduction. Any other questions? We kind of went through it to begin with, didn't we? Covered it all. We have a copy of this Obamacare issue